Very pleased to be with you today. I'm going to have some remarks in the presentation, it's not very long, about Social Security. Some of this is geared to when do you start Social Security, but as I look around the room, I see quite a bit of gray hair and even some white hair and even some no hair. So I think some of you are probably already receiving Social Security benefits, so some of this may not be new to you. But hopefully there'll be some nuggets in here that can increase your knowledge of this important benefit in retirement. In 1935 is when Social Security started, during the Great Depression, as a supplement to help folks. At that time, the average life expectancy back then was about 65. So at that age, people needed help with retirement. And this was during the Great Depression. Money was scarce. It enabled Americans to use Social Security benefits to supplement other income that they have for retirement. The demographic shifts in the population, the average life expectancy is much older now, have required changes in Social Security, and we can expect changes more in the future we can expect. So we'll talk about those in a few minutes. Your Social Security benefits are calculated on your 35 highest earnings years. That's how those are. There's a very complex formula that they used with 3 bend points to actually calculate the exact amount that you'll have available for your Social Security benefit. Most people qualify for Social Security in some form. You have to have 40 credits, and that basically is quarters, and if you've worked over 10 years, you probably qualify for some kind of Social Security benefit. If not, the spousal benefit, the survivor benefits may also be available to you. Working longer means you'll be, hopefully, as your earnings increase over the years, as your career builds, those higher earning years replace those lower earnings years. When you look back 35 years, when I look back 35 years, going back into high school and in college, at $1.60 an hour when I first started, I wasn't making much money. So those were definitely lower earnings years. But as my career has progressed, higher earnings years have helped my calculation to mean that I'll have a higher Social Security benefit because of those higher earnings years. Now, you can get benefits as early as age 62, retirement benefit. A survivor benefit could be as early as age 60, but 62 is generally the earliest that you can get retirement benefits from your Social Security. Depending on your date of birth, full benefits become available between age 65 and 67. Maximum benefits are available at age 70. If you wait till age 70, your benefit will be basically maxed out. So there's really no reason to delay taking Social Security beyond age 70. Now, once you claim that benefit, once you start your Social Security benefit, it's locked in. It'll be that same rate of benefit for the rest of your life, except there will be cost of living increases, COLAs. For this year, for example, there's 3.2% cost of living benefit. Last year, Social Security retirees got an 8.7% benefit. As inflation's coming down, the expectation I just saw recently is that there may be a 2.6% benefit this next year for 2025. Medical insurance, Medicare. I don't want to get into Eric's presentation too much, but even if you delay your Social Security benefit to age 70, you probably want to go ahead and enroll in Medicare age 65. There could be some exceptions to that. If not, there could be some penalties. And again, Eric may address some of those in a few minutes. Here's a chart that shows for probably most people in this room would be fall in these age bracket somewhere, and you can see when your total Social Security benefits would kick in. Your full retirement benefit, we call it. For example, if you're born in 1954, 66 would be the age that you get your, quote, full retirement benefit. Now, you could step up and keep that if you would delay it till age 70, and it would be even higher. But at age 66, and it gradually increases to age 67. If you were born in 1960 or later, your full benefit would be at age 67. How much do you get? What is your benefit going to be? I think they're still mailing benefits. They used to mail them out every year, but I think they've gone into a 5-year cycle of mailing out to people what your benefits would be. It's a statement of eligibility of a retirement benefit statement. If you don't have that or you want to look, you can go online. How many of you have an online account with Social Security already? Okay, I see a lot of you are already enrolled. If you don't have an online account, go to www.ssa.gov, not .com, but .gov, and you can actually pull a benefit statement. I'll show you an example here in a moment. You can start as early as age 62 or delay as late as age 70 if you want the maximum benefit. It's important that you check the benefit statement periodically to see that the income looks right. It'll be interesting that if you haven't looked at that, it's usually it's page 2 or page 3, I think, of the benefit statement. It will show your earnings history all the way back to when you first enrolled or when you first had a Social Security card and had income and paying into the benefits. It's interesting for me, again, looking back when I was in high school at making $1.60 an hour, really, it was amazing how little I was paid back then. Check that information to be sure that it's correct because it's used to calculate your benefit for all of your years of retirement. There are some online calculators that are kind of suspicious out there, so be careful if you do a Google search for Social Security benefits, what website you're on, because there can be some misleading information out there. This is what that benefit statement looks like. This is an example. That I pulled up. It's anonymous, of course, but from a client that was, I think he was a little bit over 60. Well, he was 62 in 3 months. That's why. Usually your benefit statement will show your benefits beginning at age 62 and then all the way up to age 70. For this person, his full benefits are available at age 67, and that's explained over here. I know you can't see that fine print, but 67 is the full benefits age for this person because he was born after 1960. His full benefit amount is $3,566 per month. And then with cost of living increases, that could be more next year. But that's what he would expect in today's dollars to receive if he retired at age 67 and started his benefits at age 67. If you start Social Security at age 62 and continue to work and your earnings are beyond this amount, $22,320, you're going to be penalized. They're going to pull back $1 for every $2 in your Social Security benefit. That's because the government wants you to wait to start Social Security until your full retirement age amount. Now, at that full retirement age amount, and why that's an important date, is that if you work and earn income at your full retirement age or beyond, it doesn't matter how much you make. You can work, earn well over this amount if you delay your retirement until the full retirement age 67. This has always amazed me. Retirement benefits from Social Security are taxed. All the years that we're working, paying Social Security taxes or self-employment tax withheld from your paycheck, for example, we're paying into the Social Security system. That's how Social Security is funded. But then when we start receiving those benefits, we're going to be taxed again. Good thing is it's not at the full amount. There's a special tax situations for Social Security, and it can get kind of complicated exactly how the tax is calculated, so I should refer you to your CPA or tax professional. But in general, it works like this. If you are single and don't make much money, your earnings are less than $25,000 a year, your Social Security none of it will be taxed. Another good thing is in Alabama, Social Security is not taxed at all. If you're a couple married filing jointly and you have a nice income, hopefully many of you have a nice income and have more than $44,000 in income, that's modified adjusted gross income, you'll be taxed up to 85%. Your Social Security benefits will be taxed up to 85%. It's more complicated than this, but this is a general chart to show you how you're taxed. So it's not taxed. 85% of the benefits are taxed. Okay, it would be at your effective marginal tax rate. A few years ago, there were some aggressive claiming strategies. File and suspend. Some of you may have heard of that years ago. That ended when they closed that, called a loophole. That loophole was closed in 2015. So that's not available anymore, but there are some tactical things that you can do to perhaps get more benefits through Social Security. One of which is just to delay. Just wait until later to start because your benefit's going to be higher. You can only take one benefit, though. You can't take benefit on yourself and on a spouse at the same time. Here are a few things to consider. The Social Security the administrations, they're not going to call you or send you a letter saying it's time to start Social Security. That's up to you. And it's up to you when to start that benefit, when to file for Social Security. You can do that online, or you can go into the Social Security office. There's downtown Birmingham. Social Security employees may recommend strategies that will result in a smaller benefit over your lifetime. So consider carefully your individual situation before you make a decision when you're going to start Social Security, because it has an impact for your whole lifetime then. They may say that taking it at 62 versus 70 is going to result in the same benefit. That may be true, depends on your lifespan. We can help you figure out exactly when to start Social Security to get the max benefit if we know when you're going to die. So if you can tell me that, we can get together and we can figure this out. Only the good Lord knows when we're going to pass away. Make decisions, make informed decisions, and this is an important decision to carefully consider. Some of the online benefit calculators may give you some incorrect numbers, so be careful of some online things. Here's some things to consider when you start Social Security, when you want to file. How old are you? What's your age? What have your earnings been? That's going to show up on this statement. It'll show you your past earnings that they have on their record. You want to verify, be sure those are correct. Do you expect to work in the future? How much is your spouse earning? What's their earnings? What's their Social Security benefit? Your current marital status and previous marital status. That's important because if you've been married over 10 years and you haven't remarried, you can claim a spousal Social Security benefit on your ex. And they don't even have to know about it. There's also a survivor, which would be a widower benefit. There's a Social Security disability benefit. And consider your pension as well. Put all of this together when you decide when to start Social Security, what your income needs. Maximizing your benefit, general statement, and I support this. The vast majority of workers take Social Security benefits too early to maximize their benefit. If you have a chronic disease and you know you're not going to have a long lifespan, starting Social Security earlier may make sense because you're going to get some benefit. But if you expect a long lifespan, or in my case, not so much for me, but my wife I expect will have a long lifespan. She's got good genes. My plan personally is to delay until age 70 to maximize the benefit for me, but also for my wife. When she steps up to the spousal benefit, she'll have that for the rest of her life, and that could be into her late 90s. You may regret your decision because, again, it's done. You only have 12 months to make a change if you decide, I don't want my Social Security now. I'd rather delay and have the step-up benefit. Retiring at 62, it should say starting Social Security benefit at age 62, can result in a 25 to 30% reduction in your benefit. If you go back to look at that chart that I showed you a few minutes ago, at 62 versus 65 or 67, it's going to be 25 or 30% less. This is amazing. The difference in your monthly check if you retire at 62 and 70 can be as much as 76%. It's a huge, huge difference. That's why this is such an important decision. When do you start Social Security? Now, if you want to get the higher benefit and wait to start Social Security, here's some things that you may consider. Keep your current job. Keep working. Just don't retire yet. Or get a second job. Retire from your first job. Get a second job to help you have part-time income and let that Social Security keep stepping up. Maybe reduce your spending. That's not as much fun as that's just not as much fun, but that's a strategy. I love this one. Move to a lower cost of living area. If you live in Birmingham as we do, that's not too many places with a lower cost of living than here. But those are some ways to perhaps delay your Social Security and let it keep stepping up to the higher amount and enjoy it for the rest of your life. 70 million people recently were enrolled in Social Security. 5.5 million just started their benefits recently, and 55% of all Social Security beneficiaries are women. There's trends coming. Trends have been happening and trends coming. In 1945, there was almost 42 people paying into Social Security system through payroll taxes to fund the Social Security system, to pay retirees. That has changed dramatically. In 2021, that ratio had dropped to 2.8 workers. That would be our children's generation, for example, paying into Social Security to pay for our Social Security benefits. Now, in 9 years, that's going to drop to 2.3. So the ratio is going down. As our population's aging and more people are eligible for Social Security, there's fewer and fewer people paying into it because of the demographic changes. That's what's putting the stress on the Social Security Trust Fund. In 2010, the cost of Social Security benefits exceeded the non-interest income. 2021, it exceeded the income and the interest income. And in 2034, this is significant. You may have heard this date before. In 2034, the Social Security Trust Fund will be depleted. Now, what that means is the money coming in will be the only money they have to send out. The trust fund will be gone. So the payroll taxes that our children's generation is paying into Social Security, that's all there's going to be to pay out the benefits for us as retirees. And at that point, it's projected that there'll only be a 75 to 80% payout available, unless Washington, D.C., Capitol Hill does something. What are some changes that we may see coming in ahead? I think this is very likely. We saw back in the Reagan administration, the full retirement age went up from 65, it's on the trending up to go up to 67. I wouldn't be surprised if our children's generation, we see a 70 as a full retirement age. Reduce the COLAs, reduce the cost of living increases. That could change. Right now, the cost of living increase is based on CPIW, which is the urban wage earners and clerical workers CPI, which is different. There's been proposals to change it to CPIE, CPI elderly. Nothing personal here, okay? That's probably going to. That would probably that may be a help. But whether we see that or not, I don't know. It depends on the wins in Washington D.C. and Congress. We may just see benefits reduction. That could happen. We may see the benefits, the calculations change to reduce it. We may see payroll taxes increase. Maybe we'll be retired on Social Security, but our children could see payroll taxes increase to help pay for our Social Security benefits. Or government deficit spending. Do you think we might see that? We've certainly seen it before, so we could see more of that as well. This is important. I want to make a point. Social Security is just really, it should be just a small part of the big picture for your retirement plan. I have a visual aid as we're concluding. And actually, I learned this from a representative from Social Security that used to go around and make presentations like this, explaining Social Security and talking and answering questions. But budget cuts, he's not available anymore. But I learned this from him, and it stuck with me for 15 years. A good, solid retirement plan should have 3 legs. One, basic being Social Security. Most everybody qualifies for Social Security, but it's probably not going to fund all of your monthly expenses. But it's a good, solid part of your retirement plan. Also, you should have a third leg being your nest egg, your savings, your 401k plan, your retirements, other retirement accounts, your IRAs, stocks and bonds, mutual funds, that nest egg. and a third part of the third leg being perhaps a pension. But if I ask for a show of hands, how many of you are entitled to a pension, it wouldn't be as many as we would have seen years ago. Fewer and fewer companies are offering pensions now. So that other guaranteed income, where is that going to come from? That's an important part to consider. Don't rely on Social Security only. If you don't have a pension, perhaps rental income, royalty income, annuity income, those are some other things that you can look to supplement Social Security, because Social Security is just a small piece of your big picture for your retirement. Here's a required disclaimer I've got to put up here, and there's information about me. If I'm a certified financial planner, if you'd like to visit with me, give me a call, send me an email, and we could visit further about Social Security and your needs in retirement planning income. Okay? Thank you very much.
All right, so for you guys who don't know me, my name is Eric Smith, and when you put a mic in my hand, bad things could happen or good things depending on all kinds of things, but has anybody ever karaoke'd? There's a possibility that I'll sing Islands in the Stream in a minute and pull someone up. So I will wander around. Thank you guys so much for letting me come in. I really appreciate it. Again, my name is Eric Smith. My company is Medicare Advisors of Alabama. The topic of our conversation today is helping you prepare for Medicare. So we do these meetings in our conference room that's in our office off of Columbiana Road. Today's conversation is not a full dissertation of Medicare. Those typically last about 45 minutes to an hour, and then we have some questions and stuff after those. This is sort of just a high-level view of Medicare. So how many people have ever seen this book, Medicare and You? So it's been around for a long time. The truth is that Medicare is not as complicated as it seems. There are a lot of moving pieces related to Medicare, and this book has all the answers. The problem is you don't know what questions to ask, because most of us go to work and we're employed, and our employer provides our health benefits, right? So then all of a sudden we retire, and two things are happening. I'm being bombarded with information through the mail, through the media, through whatever, about you must do something or you'll be penalized. But then I'm also an intelligent person who's trying to make a long-term decision about my health insurance with no experience to make those decisions. And you're relying on friends and family and people, and you're susceptible to being sold things, right? Because when you meet with someone who's an insurance agent like I am, somebody may try to sell you a product. So I used to work for insurance companies. I worked for Blue Cross for a long time. I worked for Viva for a long time. And then some years ago, I decided, you know what? Everybody needs the same thing, which is education, right? Regardless of what company or what product, everyone needs the same thing, which is simply just, what do I do? And to get that education, what you need more than anything is to trust the person who's educating you. So you'll make sure that you're getting the right information. So to tell you a little bit about our company, so Medicare Advisors of Alabama was founded in 2017. Our office is on Columbiana Road, right down from Shades Mountain Baptist. So if you guys know where Berry High School was, because we've got some folks who went to Berry, but now it's Pizzitz Middle School. So we're right in between Pizzitz Middle School and Shades Mountain Baptist. We're an insurance agency. We represent Medicare plans throughout Alabama and also some surrounding states. But primarily we do things in Alabama. But we also do more than just Medicare. We help people with marketplace insurance. So a lot of people who are retiring now have a spouse who's under the age of 65. We help with marketplace, or what's also known as ACA insurance. We help with that. We also do some dental and vision. We dabble in life insurance a bit, and also some international travel insurance for people who are taking trips and need some international travel insurance. We're not a part of the federal government. We're a local insurance agency. But to contact Medicare itself, you just call 1-800-MEDICARE or go to medicare.gov. So this is our team. So we have a nice-looking group. Most of these guys are at the table here. So me, Philip Richards, Dana Garvin is the lone person who has to answer the phone while we're on a field trip. And then Debbie and Tricia. So we all think of ourselves more as Medicare educators who happen to have an insurance license. But one thing I was mentioning earlier, we are insurance agents. So how do we get paid? This is a really important question so we all can be transparent. So we never charge fees. Our revenue is generated from commissions paid by insurance companies that we're contracted to represent. But commissions are regulated by CMS. I'll say CMS quite often. It's the Centers for Medicare and Medicaid. Those commissions are regulated, so there isn't an incentive to recommend one plan over the other. We represent the vast majority of every option that you have related to Medicare insurance. And our mission, our goal, is to simply live the golden rule. Just provide a valuable service. I always tell a story. I'm not a very good plumber or an electrician or a candlestick maker or any of those types of things. I just know a lot about Medicare. But I rely on people who come to my house to do work, to be honest and transparent and help me make a good decision. And sometimes you get somebody who comes out and says, this work will be $2,500. The next person comes out and says, it'll be $500. And I'm like, I'll take the $500, please, but tell me the difference between that. So you just want to have some transparency and trust between everything. So let's kind of get into a little bit about Medicare itself, and that way you guys know what I'm actually here to talk about. So Medicare is a federal health insurance program for people who are 65 years of age or older, or younger people who have disabilities, and also people with end-stage renal disease. So it was created in 1965 as part of the Social Security Act, and today it's made up of 4 parts called A, B, C, and D, which we're going to talk about in just a second. But don't confuse Medicare with Medicaid. So Medicaid is a state-based program that helps people with limited income. Some people who have very limited income can have both Medicare and Medicaid. So for example, if you're living on $900 a month Social Security check, that's your total income, you could have Medicare as your insurance and Medicaid helping you pay for the insurance. So you can have both Medicare and Medicaid, but everyone is eligible for Medicare as long as you're a U.S. resident and turn 65. But you can get Medicare early, be younger than 65 and have Medicare if you've been disabled for more than 2 years and been on Social Security disability for 2 years. So when should you start thinking about Medicare? You can think about Medicare anytime. I think about Medicare all the time, and I'm 47. So around the age of 64 is really when you want to start thinking about it, or perhaps earlier if you've been on Social Security due to a disability. And also just when you're considering retirement. So if I'm considering retirement and I'm not 65 yet, 65 is the magic age. That's when everyone becomes eligible for Medicare. But I may not want Medicare at age 65. But what happens is people tell you that if you don't enroll, you're going to be penalized, right? You better do something or you're going to be penalized. That can be true, but it's not always true. So if you or your spouse are still working and maintain health insurance through your spouse's employers or your own employer, then you can delay enrolling in Medicare until you decide to retire with no penalties. The key to Medicare is understanding that the government doesn't want to penalize you. They want to make sure that you have health insurance. So I'm 65. I'm becoming eligible for Medicare. I'm actively working. I have insurance through my employer. I'm happy about that. I don't want anything to do with Medicare. You don't have to do anything related to Medicare. It could just go right past, and then at some point, you could apply for it when you get ready to retire. The vast majority of the people, though, go ahead and enroll into Medicare Part A. That's the hospital part, because there is typically no premium for Part A. We'll have a slide on Part A in just a second, but a lot of people will say Part A is the free one. Just to let you guys know, nothing is free, even our lunch, right? So everything has a cost to it. Part A, you pay for throughout your life as you're working through FICA taxes, like we were talking about a few minutes ago. You earn Part A at no premium after you have been working for at least 10 years. But what if you move to the U.S., become a resident, you are turning 65 years old and you've lived in the U.S. for 5 years, you're a resident of the U.S., but you never paid in, you're eligible for Medicare. You just have never paid in. So Part A for that individual will be $504 a month. So a lot of people think it's free, but that's what we're paying for throughout our working lives. But the other thing about Medicare Part A is, what if I have a health savings account? My employer offers me a high deductible health plan, and I contribute to a health savings account. And I want to put my maximum amount of money in my health savings account. That individual doesn't want Part A because things get really complicated from a tax perspective, because now you're taking a government benefit and also not having to pay tax on the contributions that you're doing for your HSA. So that individual is better off just contributing to their maximum part of their HSA, putting money into this fund, and not enrolling into anything until they get ready to retire. And then we can help with that, and we'll get into some more details about that. So let's talk about these 4 parts of Medicare. So we mentioned Part A just a second ago. So our Part A is hospital insurance. That pays when you go into a hospital, skilled nursing facility, or hospice. Part B is the part that we're all familiar with. Part B is the physician's portion. Part B covers your primary care doctor, it covers your specialist, it covers outpatient surgeries, it covers home health and medical equipment. So Part B does the heavy lifting. Now, I get questions all the time about, why are there parts? Why do they make this so complicated? So it is complicated, but healthcare is complicated. Life is complicated. Why is life so complicated? So when we talk about A and B, really just think about, where did health insurance begin? Health insurance began with insurance companies, and I'll just use Blue Cross as an example. Health insurance began in the 1920s with a company like Blue Cross, who went out to hospitals and contracted with the hospitals. And employers would pay Blue Cross to negotiate with the hospitals, and those employees could simply just go to the hospital. Blue Shield was a different company. Blue Shield went out to private practice physicians and said, hey, would you contract with us, reduce your rates, and we'll have this employer group bring their employees to you because you're one of our providers. And you had a precedent that sort of was set many decades ago of hospital benefits and physicians' benefits. Now, I'm simplifying complex stuff here. But you fast forward some decades, and when Medicare started, they didn't invent the wheel. They just basically did what was already established, which was having hospital insurance and physicians' benefits, Part A, Part B. Nothing was added to that until the late 90s. Early 2000s, late 90s, Part C was added. Part C, just to read it, is a Medicare Advantage plan. It's a type of Medicare health plan offered by private companies that contract with Medicare to provide all of your Part A and Part B benefits. Most Medicare Advantage plans also offer prescription drug coverage. Your Medicare services aren't paid for by original Medicare. How many people understand that paragraph? No one. Perfect. So we can go to some other slides. That's what we're going to talk about a good bit here in just a second. Part D, that's your prescription drug coverage. That was passed in 2004 and went into effect really in 2006. So just to kind of help you understand, we have these 2 parts, A and B, hospital and physicians insurance. We have this thing that's called Part C that was created in the late 90s, and then we have this thing called Part D that happened in 2004. So Medicare just happens over time. This is my favorite page. So I'm going to spend about 2 hours on this page. I'm just kidding, just seeing if you guys are still awake. These folks at this table know I can spend 2 hours on this page. But I call this page a Medicare skeleton. And the reality is that there's 4 parts to Medicare, but there's really just 2 options. So the number of insurance companies that advertise to you, the number of agents like me who advertise to you, everyone's talking about these 2 options. And it's really simple. You have a traditional Medicare system, and that's what everyone is familiar with. So when we talk about Medicare, A and B, what happens is, without getting into a whole lot of detail about it, when I show up at the physician's office, Part B, the physician's portion of the insurance, is going to pay 80% of my physician's claims, and I, as an individual, am going to owe 20% of that physician's claim. Very simple. The problem is that there's no cap to what that 20% could be. So it's 20% to an infinite number. So if we're looking at 1965, 1970, 75, maybe 20% isn't a lot. 2024, I don't know what 20% could be. 20% of surgeries could be a whole lot. So when I have traditional Medicare, I mentioned earlier, Part A has no premium, but Part B definitely does. So Part B's current premium is around $175 per month. That's also based on your income. So if I'm retiring and my income as a couple is more than $200,000 a year, I could look at having to pay more for Part B. When we meet people in our office, we get into a lot more detail about that to also help people understand that that extra amount of money that you pay isn't forever because your income fluctuates. And if you're retiring and you've made a good bit of money prior to becoming eligible for Medicare, you can fast forward a little bit in time and let Social Security know that you've left work, and there's a form that you can complete to reduce that amount of money. So we help a lot of people with that, just to let you know. But what I want y'all to understand just for our meeting here is that this first box that you see, and I'll move over here so you guys can, everybody on the other side of the room won't see my big head. So traditional Medicare, what's on the left-hand side, that first box that's at the top is your Medicare card. That has Medicare Part A and Medicare Part B. Let's say that costs $175 per month. And Medicare itself, the federal government, is paying to the physicians through what's called a fee-for-service program, where the physicians receive a fee for the service that they provide. And the government sets that fee schedule, and they receive 80% of whatever that amount of money is, and you pay the 20% unless you add insurance to your Medicare insurance, which is called a supplement, also known as a Medigap insurance. So if I have a Medicare card, then this second card, the second box that's there, you purchase insurance in addition to your Medicare insurance to cover that 20%. So the Medicare supplement or Medigap insurance is not Part C. It's not a part of Medicare. It is simply you buying insurance to protect you against that 20%. So remember earlier when I said you owed 20% for an uncapped amount? Well, by buying a Medicare supplement, you're capping your 20%. So what happens is I give an insurance company some money, and let's just say it's $150 a month. Then that insurance company will pay my 20% on my behalf. So what I have is two cards. I have a Medicare card paying 80% and a Medicare supplement card paying 20%, and then I owe 0%. Does that make sense? So if I have the traditional Medicare route, a lot of people will say, oh, when I go to the hospital or I go to the doctor, everything is free. It's not free. You pay two different insurance premiums. One's paying 80%, the other one's paying 20%, and you owe 0%. But then you also have to purchase a prescription drug plan that stands by itself. So with traditional Medicare, you're itemizing your insurance, 80%, 20% drug insurance. Does that make sense? Where people get really confused is the right-hand side. So how many people have been insured through an employer? Right, so everybody basically. And most of the time, that employer in Alabama is probably Blue Cross, right? But it could be other companies. If you work for UAB, it could be Viva, it could be some other companies. But most of us have been insured by Blue Cross at some point. When you get ready to retire or go on to Medicare, you can have insurance companies who sell you products, right? So you can have a Medicare supplement policy sold by an insurance company. Part D, or prescription drug plans, those are not administered by the federal government. I mean, those are not sold by the federal government. They're administered by the federal government, but sold by private insurance companies that have contracted with the federal government. Medicare Advantage, or what's known as Part C, is actually a choice. So the C stands for choice. And the choice is, do I want to choose the traditional Medicare route, or would I rather have my Medicare benefits administered by an insurance company, just like I had when I was employed? Because I worked for a company, my company has put my insurance plan together. Now that I'm retiring, I have a choice. Do I choose the fee-for-service option, buy a supplement to back that card up, and then buy a drug plan, or do I just choose to let an insurance company administer my benefits altogether? If I choose a Medicare Advantage plan to administer my benefits, I still have Medicare, but when I go to the physician, the physician will file a claim to my insurance company and not directly to Medicare. So Medicare is not going to pay 80%. Your insurance isn't paying 20%. Your Medicare Advantage plan is paying 100% of what they've told the physician that they would pay, and you simply pay a co-payment. Very similar to what you've had while you're working. So I'm going to pay $5 or $10 or $20 or $30. So this is where the choice comes in. So if I'm going to let an insurance company administer my benefits, I want to know, what are those co-payments? What does it cost me at the hospital? What does it cost me at the doctor? What does it cost me, when I go get a prescription? And do my doctors accept the plan? Because physicians can agree to accept whatever insurance companies they want to. A lot of people will say, if I choose a Medicare Advantage plan, that they make you choose their doctors. You can't choose your own doctors. And that's not true. You can always choose your own doctor, right? The question is always, do the doctors that I work with accept the insurance company that I've chosen? I know that seems like splitting hairs, but it's really important to understand the concept that every insurance company would like to work with every physician, right? Because that would be really great from a marketing perspective. But not every physician wants to work with every insurance company. I can guarantee you that. So if you're looking at an insurance plan, then you need to say, here are my physicians, here are my prescriptions. And that's sort of what we do. So we don't care whether you choose the traditional Medicare route or the Medicare Advantage route, or even if you're insured by your employer and they're going to offer you health insurance in retirement. So if you're a retired teacher, a lot of people have PHIP, right? PHIP is a great option. Retirement Systems of Alabama simply has chosen this same option. And if I'm a retired teacher, I'm going to be put with a Medicare Advantage plan that's through United Healthcare. It's a really good plan. A lot of people come to us because they're very confused about it, and we simply just explain to them how it works. And not everybody sticks with it, but the vast majority of people should. It's just about taking that information and making sure that people understand how it works. So this is a QR code. My wife thought it was funny that there's a dinosaur in the middle. I didn't put that dinosaur there, it just appeared. But that's our address. Our website to our office is medicareadvice.org. If you ever wanted to schedule an appointment or ask us a question, don't hesitate to call. We teach these classes at our office that are in a lot more detail, and then we meet with people individually, one-on-one. So as you get ready to retire, like we said earlier, when should you start thinking about it? I would say around 64, because it's never too early to think about it. And if you're closer to 65, we help a lot of people apply for Medicare A and B. There are certain forms that you need to be able to apply. We have those forms in our office. We do a lot of extra work to help you get those forms to the Social Security Administration appropriately and timely. Any way we can help, we're absolutely happy to.
Yes. We're going to take some time for questions, but as a layman, I was just sitting there listening to it, and one of the things that Larry said very importantly, don't look for something on the phone from Social Security. It will be in a letter. Lots of scams out there where they come on the phone and say, you need to do this, you need to do that, I need your Social Security number. You don't want to do that. They always communicate in a letter. You need to know that. It's very important. The other thing that Larry said in terms of it depends on your income and when you think you're going to die. Obviously, most of us don't know when we're going to die. We need to be thinking about eternity, don't we? But so you have to take what you make, your wife made, if she works or just works in the home, or all those things you have to take into account in trying to figure out when to take your Social Security. Just as a layman, because Ann was a teacher, my wife was a teacher, and we knew it wasn't that she made that much, but we knew we took a pretty significant drop in our income at that point. We decided to take Social Security earlier, but we deferred mine to 70. So every situation is different. That's why it's good to talk to people that have done it, or these men up here. And obviously Medicare, all of us that have use that. You have an opportunity every year to change from October to December, early December, to change. And I made the change from Blue Cross to another one, and that's been very helpful. But I didn't know when I did it how helpful it would be. So again, talk to people that you know and that have done it. That will be very helpful. So questions from the floor. Do you need a second job if you don't think Social Security are going to cover it, if you don't want to take it all the way to 70, if you need a second job, and how many hours?
It's not an hourly number of hours that's the key thing there. It's the amount of earnings that you have. If you decide to take a second job after starting Social Security at age 62 or 63 or 64, if your part-time earnings are more than $22,360 a year, that's where the penalty kicks in, and they'll start clawing back after they find out $1 for every $2 that you've earned. You'll probably get that back as an increased benefit after your full retirement age benefit, but it's not the number of hours, it's the earnings amount that's a key number there, $22,360.
So his question was, could you, because you become eligible for Medicare at age 65, but you were still working, could you be working, having group insurance, and also having Medicare at the same time? When I'm actively working, my group insurance is going to be primary, and Medicare in that case would be secondary. I think it just depends on what your benefits are at work, and then how Medicare will play into that and how much your Part B premium is. So, for example, if you have, sometimes people are overinsured, where they have a lot of insurance. Like, for example, we had a person a couple of weeks ago who had they had their group insurance, which was a high deductible health plan, and then their company had purchased them what's essentially a supplement to pick up their deductible, and they also had Medicare to go along with that. That is just too much insurance because they were barely paying anything anyway, and they were just overspending. So that's a hard question to answer. Is it worth it? Because you just don't know. You don't know enough about those benefits. And also, if your income is higher, so let's just say we were talking about a high income earner. If I'm making $300,000 a year and I also have my group insurance and I also want to take Medicare, it just may be too expensive. And so you really want to look at your scenario. The flip side of that, one of the things that we really help a lot of couples with who never think about this is, let's just say that you're under your group insurance and it's a really good policy, but maybe your company pays 100% of your health benefits, but they cause you to pay 50% of your spouse's benefits. And then your spouse turns 65, but maybe their insurance costs, $400 or $500 a month under your group insurance, but your spouse is 65. A real easy thing to do if it works out benefit-wise is to peel your spouse off of your group insurance. You go down to single coverage, and then your spouse goes on to Medicare, and you just continue to work. And that's really just a math question. It's not a true benefit question. It's a little bit about benefits, but it really is just about which is the most affordable. And that's, Philip and I do that every day, just working out those math problems to see, is this beneficial to you? If you're actively working, your insurance at work is primary, unless the only scenario is if you have a very small employer. So if you have less than 20 employees at a company, that can be a little bit tricky because your small employers, you may be required to go on Medicare, but that's not always true because not with Blue Cross. There's a certain type of plan with Blue Cross that you don't have to do that. So a good rule of thumb is that if you work for an employer that has less than 20 employees, just a really small group, I really advise checking with me and Philip just to kind of say, hey, especially if it's a Blue Cross policy, because we know a lot of people at Blue Cross and can easily email them to say, hey, here's this, contract number. Is this person required to go on Medicare because it's a smaller group? But the vast majority of the people do not have to do that. The penalties only happen if you just don't have health insurance at all. So just to help you guys understand that, so his question was, do all the Part C providers, which would be Medicare Advantage plans, do they treat all the prescription drugs the same? So prescription drugs are super complicated. You could have, there's thousands and thousands of prescription drugs, and whether it's a standalone prescription drug plan, like a Part D standalone, or a Medicare Advantage plan that has a drug plan embedded into it, there's a huge bucket of prescription drugs that are FDA approved that those plans can pick out of. But what has to happen is that every carrier who offers a prescription drug plan has to have an adequate formulary. So we were actually just talking about that this morning, that if you have diabetic drugs, for example, and let's just say there's 10 insulins, well, maybe the rule says you have to cover 50% of those, and so those insurance companies have to cover an adequate amount, so they have to meet the minimum, but they could also have more. And that's what we call a narrow formulary or a robust formulary, one that includes more than the minimum or one that just includes the minimum. So what we try to do is not only look at your physicians, but really hone in on your prescription drugs and making sure that and there's a huge change that's coming on the prescription drug side for 2025, where everyone's prescription drugs in the country are going to be capped at $2,000 when it comes to Medicare. So your prescription drug cost in 2025 can't exceed $2,000. That is a brand new thing that has been in the works for several years now. So this fall, so the enrollment period is October the 15th until December the 7th. This is also an election year, so we're going to have inundated commercials of politics and Medicare, so just prepare for that because there's going to be a lot of confusion this year related to that drug portion. I hope that answered your question.
Can I add something to that also? I believe the Medicare.gov website has a port of that website where you can put in your prescription drugs and actually compare different supplemental Part B plans, Part D plans, and Advantage plans to see which one may give you the most benefit.
Let's thank them again for being here. Great. I do want to call your attention to the cards again. We would love to help you. One of the things about finishing well is this. Not only do we want you to have an impact, but all of us know we're more vulnerable than we used to be. We're not 10 foot tall and bulletproof anymore. And so we need each other, I think, more strategically. We need to pray for one another. We need to be accountable to each other, help each other. I went to visit in Richmond, Virginia, a similar ministry, and they met every 2 weeks at different places. And one of the guys said, we take roll. And I said, what do you mean you take roll? He said, well, there are guys that come every 2 weeks, and if we don't see them, we wonder why they're not there. We may be the only people that know these people in Richmond, and so we want to know if they're not there. We want to check on them. And that's a part of what we do. We unashamedly believe that Jesus is the answer, that we're preparing for eternity, not just our life here, and we would love to walk alongside with you that. We have an investigative study on the claims of Christ, and we would love to be a part of that. So if you will take your card and write on there, put finish well so we know you were here for this, and any way we can help you, take the website, little thing so you can see what else we have to offer. But we really do appreciate you being here. We appreciate Hoover for hosting us and these men that taped us, that are always doing a great job for us. So let me close in prayer. Father, thank you for this time, and we do want to be wise as serpents and innocent as doves. Lord, we want to need your wisdom, really, to make these decisions, because we don't know what's going to happen today or tomorrow. But we want to be help each other and plan for our children, our grandchildren, that they won't be saddled with a lot of these issues. So, Lord, guide us as we leave. And again, we thank you for this time. In Jesus' name, amen.